just to repeat my two objectives. One is to relieve suffering, and two is to show evidence that the methods we use work. And we can only do that if we get feedback from people who are willing to share their experience with us. These are very rare because people don't like to share their experiences of this kind generally. So we have to be very, very careful with the information that's disclosed, because we don't want people to be recognised. And it does actually take a brave person to declare that they have received benefit from this kind of work. So when we do get a testimonial, I do ask for permission for it to be shared, and we have permission to share this case, the testimonial. And this is the testimonial that I got back from case 770. And the client says, "Dear Dr. Palmer, you performed a remote spirit release for us recently for a friend. We noticed an immediate and huge change. We were no longer besieged by her delusional accusations and demands. Instead, there seemed to be a rational person there who could be reasoned with. And today we received a long note of apology from her." And she goes on to say, "I cannot thank you enough. I find it perfect to think that we were able to help ourselves best by helping someone else. But it needed a miracle, and you and your team have provided that miracle." Now, for myself and my team, this is not a miracle to us. This is daily work. But it's welcoming to receive acknowledgement from someone like this, who's prepared to put pen to paper, so to speak, and declare the efficacy of our work. And this is important for us to share with the medical psychiatric community, because we're dealing here with someone who was perhaps, I don't know, but perhaps delusional in their thinking. They may have been diagnosed with some psychiatric disorder, possibly, that would explain, in medical terms, their behaviour. But what we found here was a spiritual cause and a spiritual solution. So I'd like to present this case for study and to invite those counsellors, psychiatrists, therapists, doctors who really do want to heal the sick using methods that are far less costly and less invasive with medication, to consider these possibilities. And I'm going to leave this case study with you. Thank you for listening. I just wanted to give a quick feedback on case 232. This is a letter I received from the client 2 days after the second session. And this is what he says. "Dear Dr. Palmer, I wanted to thank you very much for your help with my spirit attachment. You have no idea how much a relief it is for me. I've made changes in my life, removing the psychedelic chemicals, and I've even begun recovery in Alcoholics Anonymous." Now, I didn't know he was also suffering from alcoholic addiction. He goes on to say, "I went to a straight psychic that confirmed the removal. I have felt a little residual effect of a heat sensation that I feel on my right side that I thought was still the possessing entity. The psychic confirmed that it was an echo effect of myself. He also added that it could be like a scar or reminder of what I went through and not to be worried about it. Even though I still feel it, I find that it's slowly dissipating. I do feel many, many times stronger and more grounded as well. If at any time you'd like to discuss my experience and battles with this, I'd be happy to share, and I will always be grateful. So there we have efficacy, a report back that the intervention that we performed using the remote method, telepathy, has had an effect. It works. But this case also raises many, many more questions for the scientist, for the researcher. For example, the entities that are experienced whilst under the influence of a mind-altering substance like DMT or ayahuasca or psilocybin, are they genuine hallucinations that are caused by the drug, or is the mind loosened? The filtering mechanism of the brain, is it loosened to allow the mind to access other dimensions, as in the case of the use of ayahuasca with shamanic journeying? So these are fundamental questions that this particular case helps to address. For me, as a practitioner, the most important factor is that the method alleviates distress for the client. That is the primary objective, to ease the suffering and to heal the sick. The secondary, and some would say even more important objective, is to investigate the ontological reality of spirits. Do they exist? Are there other dimensions? And what I'd like to suggest to researchers and scientists is that this method of working opens an avenue of exploration that is infinite. And I'd like to encourage more research and discussion on these topics by researchers who are genuinely interested in the nature of consciousness, alternative realms of existence, and so on. And I shall leave it there for now. This is a continuation report on the case number 163 concerning the 71-year-old woman who had been diagnosed with psychosis some 30 years ago. And we're acting, the client is her daughter, so we're acting on the instructions and requests of the daughter. Now, I posted a report on the 31st of August. It was file number 163/5. And the end of that report suggested there was more to come. Well, there has been more. There's been a third request and more communication with the client, but I just want to read this latest report that's just come through this morning. It is the 11th of September. And the client says, "Good morning, Terry. I'm very happy to report some more improvements and progression with regard to my mum since the third intervention. My brother and I visited her last night and she was in a very, very good state. She looked very well. She's coloured her hair, cleaned up the flat, and she cooked dinner for us, and she even baked a cake for us." Now, she used to cook and bake a lot. I'm assuming she means when they were children. Because remember, this patient has had this problem for 30 years. She used to cook and bake a lot, but because she's been in such a bad state for so long, she's not baked a cake in years. It actually made our jaws drop. You should have seen our faces when she showed us the cake. Do you remember not long ago she would lie drunken on the sofa and talk about aliens who rape her at night, and she wouldn't look at us or talk to us properly? A few weeks ago, when I told my brother about spirit release therapy, he was open but sceptical. Yesterday, he had to admit that these are not coincidences anymore, and that whatever you are doing is working. My mother's made a quantum leap since the last intervention. I'm not sure which part of the session actually made her recover so well. Well, in fact, there are several elements that need to work together. There are different concepts that contribute to a problem, and they all have to be addressed. It's not just one thing. It's not just one magic bullet. It's a combination of factors, and they all need to be recognised, understood, and dealt with. She goes on to say, the part where Chen, that's our spirit guide, and his team put her etheric body back into a physical body the right way round, or the part when you removed the anxiety from her and put a protective bubble of light around her, or the part when you connected to her higher self and introduced yourself to her and explained the work that you're doing. Now, this takes us to the next level. Removing spirit entities that are attached is the first part of the process. When we dealt with that, and of course there have been 3 sessions now where all these different facets of intrusion have to be dealt with on different levels. Then we have to start working at the psychological level with the individual themselves, and this is where telepathic communication and telepathic hypnosis come into their own. So I had a conversation with the woman directly after having asked permission from her higher self. So the client goes on to say, the part where you connected to her higher self, that's where we asked permission and introduced yourself to her and explained the work that you're doing. So I had a detailed conversation with the client. It's recorded, but I've skipped that part just to reach this outcome. I agree with you that she has suffered a great deal of damage for many years, and of course she will not recover overnight. It will take time to go through all the layers, and who knows what else may come up. But I think you've achieved already so much, and we are on a very good pathway. My brother and I are so happy. It's not only great for my mum to feel better, but it's also really relieves me and my brother so much. It has been a heavy burden for so many years to watch someone you love deteriorate and struggle so badly. So we want to thank you and Andrew and Chen and his team for the work you do and your kindness. We're very grateful. Now, the important lesson for me is that this is validation, endorsement of the work that we do. We need to provide evidence to psychiatry that these principles are real, that they do work, and that there is a means of treating the sick here who have been diagnosed with psychosis, an alternative way of treating them without just putting them in hospital and giving them drugs. These are techniques that are simple to learn. Not only do I want to offer evidence that these techniques work, I'd like to help psychiatrists learn how to use them. And that's the whole point of this exercise. So help me spread the word and educate psychiatry. Thank you for listening.